Hey, welcome back. If you are listening on the day of release for this episode, it is December the 26th. That means it's the day after Christmas. If you celebrate Christmas, I hope you had a Merry Christmas. And if not, I still hope you had a great day. Today's guest is Abigail Barber, and she and I discuss in this episode disordered eating. But I think it's an important yet controversial topic to discuss, and controversial because there are different perspectives. It kind of depends on which nutritionist and which therapist you're talking to about these things. But it's good to get different perspectives on what causes eating disorders and how to address them. So I hope you enjoy it. I wanted to mention one more thing. This is the last time I'm going to say this. I'm offering a 20% discount on all of my packages before the end of the year. So if you want to take advantage of that, make sure you go to my website by December 31st. That's beavercreekwellness.com. Go to appointments, click on book now under one of the packages, and use the promo code podcast24 for 20% off your first payment. Welcome to the Real Food Mental Health Podcast, where we explore the powerful connection between mental and physical health. My name is Cody Cox, a holistic nutritional psychotherapist, and I'm here to guide you on a journey to true wellness, mind, body, and spirit. If you're tired of quick fixes and want real solutions that address the root cause, you're in the right place. Let's get started on your path to lasting wellness. Welcome back to the Real Food Mental Health Podcast. Today's guest is Abigail Barber, who is a nutritional therapy practitioner from Jacksonville, Florida. She began her journey into the holistic health space as a teenager, watching her mother conquer a long-term autoimmune disease through natural means, as well as facing a health struggle of her own, a 7-year battle with an eating disorder. Since then, she has worked in health food stores, organic delis, and nonprofits that promote community wellness. She founded her own nutritional therapy practice and named it Enduring Wellness to highlight the deep and lasting healing that takes place when we choose a root cause, real food mindset. Her passions in the health space include mental and emotional wellness, women's health, and culinary wellness. Welcome, Abigail.
Thanks, Cody. It's good to be here.
Tell us a little bit about your backstory. What got you into holistic health? I mean, obviously, I read some of that in your bio. You have a history with an eating disorder. You kind of saw your mom get into that, but what made you want to be a practitioner?
That's a really good question. And because this podcast isn't 3 hours long, I'll try to give the summary version. But I think there were two driving factors that really made me get into the holistic mindset and approach to health. One did come through my journey with the eating disorder, um, because I had been exposed to two different worlds. Like I mentioned, my mother had struggled with an autoimmune disease, and so our whole family had taken this journey into the health and wellness space, into approaching things not from just a symptoms approach, but from a root cause approach, eating healthier, learning terms like what it meant to be gluten free or what it meant to be paleo or what it meant to be all these different things. Then you have me going through an eating disorder, which is, of course, characterized by obsessive forms of restriction and manipulating food for in a certain way. So having to come to grips with both of those and figure out what I knew to be nutritional reality or what I knew to be true nutritionally without letting it control your life really just pushed me forward into trying to understand more about what holistic health really means. So that, and I know we'll probably get into that today, but I also want to say too that I think what drove me to get training through the Nutritional Therapy Association, what drove me to make this my life's passion, really came through working in local health food stores. And what was a passion took on a new life of its own when I realized, in a certain sense, we're all trying to figure this all out, and it's becoming a lot more professionalized. The health and wellness space is becoming more documented. I feel like there's more research around it. But even a couple of years ago, it was kind of people just trying to figure out. And I read on Dr. So-and-so's blog that you should try this. And well, have you tried this herb? Have you tried this? And we're all just trying to figure it out. And I thought, let me see if there's a place where I can get some credentials, some learning, some kind of a comprehensive, grounded education on where to go with this. And so that when I talk to people, I'm not just saying, well, hey, I heard so and so said this, but I actually understand how the body works. I understand how food plays a role in that. And so I think that both of those pieces together put me where I am right now, just passionate about um, holistic wellness, but also how it integrates into real life problems like eating disorders or like people who are coming from a more conventional mindset. So that's what I would say.
Yeah, so you worked at multiple health food stores, or you were just at one for a while and
Mostly
decided
just
to move
one.
on, or okay.
Mostly just one. I ended up moving across the country, so that kind of changed that a little bit. But my time at
Oh,
this
okay.
local health food store was huge. I absolutely loved it. It was great.
Yeah, and I think if I were on a similar path, I would eventually want more training too, because like being in that environment of a health food store where I think most shoppers are fairly health conscious. That's why they come there in the first place,
Mhm.
right? Like
Mhm.
once in a while, you get shoppers who are just curious and maybe they just want a quick snack, but they don't really care if it's healthy. But most of them are there for a reason, and as an employee, that probably made you really curious. And it's like, well, I really want better training so I can help people like this rather
Mhm.
than simply checking out their groceries for them.
Yes, and most people would come in, and you're right, they were very health conscious. And I just learned a ton because you never knew who was going to walk in the door. And someone might walk in the door and be like, "So I heard lectins are bad for you." And I was like, "I don't even know what a lectin is, but I'm going to look it up and let's talk about this." Or, "Do you know of an herb that can help with blah blah blah?" I'm just like, "Well, let's look it up." So definitely learned a lot, and the customers taught me a lot.
Yeah, and I like what you said too about how like there's more research now, thankfully. And honestly, I don't know who we can thank for that, but I've noticed that there is more.
Hmm.
Maybe that's a confirmation bias thing on our parts. I don't know, but it does seem like there's more, and it might be that they're independently funded, people who just really want to get that information out, so they're willing to just get it out regardless of the cost. But people don't realize, like when we go to school, whether it's high school, it's college, or even starting in elementary school, we're taught these very specific dogmatic principles that, in my opinion, are based on biased and outdated research. And if we end up with a health problem or we have a loved one with a health problem, we find ourselves at a loss for information, even when we talk to the doctor. And so we have to start taking it upon ourselves to find more information. And usually that's kind of when we go down that rabbit hole, so to speak. But there are trainings and there are really good sources of research out there in recent years. And I would agree with you on that point too, that it seems like in the last couple years particularly. And again, I don't know why, but it is a good thing.
It is a good thing. It is a good thing. I think even a few years ago, you talk to someone about taking a probiotic, and they'd be like, "What? Why? And what is that?" But now it's like common. Everyone's like, "Oh yeah, yeah, I went and got probiotics." And you're like, "Okay, well that's good," you know. So definitely progress.
Yeah, and probiotics too. Most of these things we can get from real food, where it's like you don't even have to take a supplement most of the
Mhm.
time. You can eat fermented foods and still get probiotics. You can dig in a garden and get probiotics, even when you're not eating the soil yourself.
Mhm. Yeah.
Like there are different ways of getting these nutrients that we don't realize because once again we're taught to buy a product or we're
Mhm.
taught to buy a service.
Mhm.
So, kind of coming back to your personal story as you navigated through this eating disorder, you worked at the health food store, you kind of saw your mom work her way through an autoimmune disease. What was the main thing that you found that helped?
Wow, that's a really good question. I think I think it goes back to kind of what you touched on about how you view food. And I think even working with clients or working with people who are sort of in the standard American diet or in just culture haven't really thought about food this way is that it's primarily a matter of like taste or convenience or just what you're used to, and you're not used to thinking of food as medicine. And if you think about it that way, nobody's like, oh, my medicine doesn't taste good, I don't think I'll take it, or oh yeah, I don't feel like it today, I guess I'll just skip my medicine. um and that's not to say that then the real food isn't good, because of course I'm very passionate about you can make it delicious, and it's all about shifting your taste buds from hyper palatable to, but that's another discussion. But I think realizing that food is a tool, maybe we say it that way, like food is a tool and it's a resource, and if you unlock that resource, you can get a whole lot of benefit from it. It's not just something you've got to eat to survive, but like in my mom's case, she realized if I take out this and this, then that's going to stop having an inflammatory effect on my body. And if I put in this and that or intentionally focus on this, it's going to give me these nutrients or these things to then help my body feel better. When you eat well, you feel better, you then naturally begin to just have an affection for those foods. I think then for the eating disorder, also just me personally, having to do the hard work of learning not to fear food, which is very needed and very important, and to not be afraid to eat pizza or not be afraid to eat these things. And then there came a time where I had to choose a healthy mindset shift to realize that I can still view food as a tool, without letting it, you know, be a tool for the wrong reasons. Like it can be a tool for the right reasons, and I can have a healthy perspective on that. But just the common theme of how are you going to make your food work for you instead of you serving either your taste buds or convenience or whatever those things may be. So I don't know if that makes sense, but that's kind of a general theme I think I would say is.
Yeah, food is medicine. And as you were talking, I was kind of thinking like dietitians generally, I can't speak for all of them because some of them are very holistic, but generally they are taught that food is fuel and that's pretty much it.
Mm-hmm.
And it's like, in a way, I feel like because they teach the general public that principle, it almost encourages disordered eating habits.
Mm.
What would you say is the main cause for disordered eating?
There's so many different reasons. I feel like they're individual, but I'd say if there were big categories, I mean, one is just, and it gets talked about and it's being more talked about, but just the media. And I know for me that was huge, what's being portrayed as what's normal for a woman or a man to look like. And um, that if I'm, especially if you're a type A person, you're like, if I don't look like this, then there must be something wrong. And I need to change my body so that I can look like this or be like this. So I think media and the use of Photoshop and all those things do play a role in it. Um, I think you could go a little bit more philosophical. I mean, some people turn to it because of trauma, because of uncontrolled things in their life. I know I have friends who that's the case, where it was family situations or abusive situations that then made them focus on what I can control. It all kind of stems back to control in some ways. And I mean, it could also be just the food itself. I mean, maybe the standard American diet, the ultra processed foods, it's not good for your brain, and stuff happens and you're not in a good space, and so you're more prone to these obsessive compulsive thoughts and just diet culture in general. I think a lot of people probably have undiagnosed eating disorders because, unfortunately, especially women, because it's considered normal. It's nobody blinks an eye if a woman goes on a diet, and nobody questions a lot of times, at least I found, if you lose weight, nobody tends to assume that it might be a bad thing. Everybody's very quick to praise you. And so I think things like that, and probably all of those things combined, go against someone if they're trying to battle an eating disorder.
Yeah, I mean, sorry, I kind of put you on the spot with a loaded question there,
Hey, I
but
love it. I love loaded
but
questions.
I totally agree, though. I mean, there are so many things that culminate into disordered eating, and so I think it's worth pointing out, though, that like as a therapist myself, I can diagnose people with eating disorders, and I do agree. There's a lot of disordered eating out there, but disordered eating isn't necessarily diagnosable. And so that's where like people get really confused. So orthorexia, for instance, is not a diagnosable condition, but I would call that disordered eating.
Mm-hmm. Yes.
And so people get confused with the official clinical terminology, but in my mind as a nutritionist, it's still disordered eating and it probably still should be addressed in some
Mm-hmm.
way. Going back to with food being merely fuel, I was thinking maybe that's one of the major causes of disordered eating because we tend to oversimplify its importance. And
Mm,
you were talking about how food is medicine. It's not just fuel. It's nourishment.
yes.
And we tend to forget that like when we look at food, we tend to forget this food is going to nourish my body and make up the cells that my body needs to be healthy, to
Mm-hmm.
have energy, to do all these things that I need to do in this life. It is not simply fuel. The body itself is made up entirely of nutrients. And so when we oversimplify food and call it fuel, we are implying that the body would exist without nutrients.
Mm-hmm. That's a really good point, and I'm picking up what you're putting down because it's in the diet culture or in popular culture, food is basically reduced to how many calories. Like the merit of food is encapsulated in how many calories it contains. So that's a very good point that if you're, and then you say, well, okay, if you want to lose weight, just cut your calories. You're not thinking about the nutrients you're depriving yourself of, and I wasn't thinking about what my hormones need to be fully functional. I wasn't thinking about what my thyroid needs. I wasn't thinking about, because nobody talks about that. They just talk about how you look. And so that's a very good point. I definitely resonate with that.
And there are certain nutrients too that I've come across in various research books and things that supposedly really help with disordered eating. Have you found anything like in your work or in your own research, specifically like foods or supplements that might be really helpful in
Mm.
improving a person's body image and motivation to change their food habits?
Yes, from a food perspective, it's I mean, that's the trick with eating disorders. It is a revolving door. When your body has more nutrients to work with, especially when your brain has more nutrients to work with, it's going to recover. It's going to start thinking on a different plane. But if you're in a state where you're restricting, there's a bit of a tug of war of the the forces that are telling you not to eat, and then what you really need. But I know I experienced as I began to recover and began to take in more nutrition just in general, then you begin to start thinking more clearly and you begin to be like, oh, I have more energy. I have more ability to think. Um, I think if somebody's, trying to actively recover from an eating disorder, I mean, I know that um, anything that would be good for brain health, like more carbohydrates. That is something that I've at least personally found, and I think other people I've talked to, that's one of the things that gets most restricted. And because carbohydrates are so important for your brain and for your energy and just your stamina, it's amazing how once you've restricted them and then you start to eat them, you're like, whoa, I feel really good. How am I not like, why did I not feel this good before? And then you're like, oh, it was carbohydrates. So, things in general like that, healthy fats for the brain. Um, and then I think, all the micronutrients, and this is a bit of a, of a sidestep, but I think one of the things that I was really passionate about is that 2 years into my recovery, real active recovery, I began seeing a holistic practitioner who did muscle testing and did different modalities and assigned supplements. And what I realized is the eating disorder wreaks so much havoc on your organs, like your thyroid, like your liver, and so specific nutrients targeted at those, um, nutrients for the thyroid, nutrients for liver, all those things, then help your body actually heal and repair. So I don't know that I could point out any one nutrient that is like, oh yes, that, but just in general, having micronutrient and macronutrient rich, but not to overlook the micronutrients because that's really important for repairing your body.
Yeah, and the micronutrients are often overlooked, especially when we're listening to conventional dietitians,
Hmm.
because they're not really taught to focus on the micronutrients. So for listeners who don't know what micronutrients are, essentially they are vitamins and minerals.
Yes.
And you could take that a little further, maybe the essential fatty acids and certain amino acids, things like that too. But these are really the smaller nutrients that pack a big punch as far as the function goes in the body. So it's not just about focusing on fats, carbs, and protein.
Yes. Or focusing on mere calories. Just, okay, you need to just ingest enough calories, which at a certain point is needed, especially in more severe eating disorder cases. But there definitely needs to be a consideration for that because you're trying to rebuild not just body composition, but your organs really from the inside out. So it's very
Yeah,
important.
and once your organs are rebuilding and they're repairing, your body is going to function better, which means your brain is going to function better,
Mm-hmm.
and you're just going to feel better overall. And so that's kind of my speculation. I wasn't anticipating that we would go at eating disorders with this angle
Mm-hmm.
today, but there is a book called Gut and Psychology Syndrome by Dr. Natasha Campbell McBride.
Mm-hmm.
And that book specifically talks about disordered eating and how repairing the gut through whole foods can really help a person with an eating disorder. And because I wasn't anticipating talking about this, I didn't review it. So I can't, like, off the top of my head, explain why. But if I were to speculate, it really is just about repairing the gut with whole
Mm-hmm.
foods. Because as you repair the gut, you're also repairing the signals from the gut to the brain.
Mm-hmm.
And a lot of us don't realize that there is a very strong connection between the gut and the brain. And it really affects mental health when we've got digestive issues.
Yes. And I'd like to bring up a thread too because you mentioned digestive issues because this is another nuance to throw out there is, you know, part of struggle of eating disorder and recovery is digestive problems, dealing with bloating, dealing with constipation, dealing with all these things that can then feed the negative thoughts and the negative feedback loop of not wanting to eat. So I think that that's also a huge part of it, and it was huge for me to get my digestion back online because then it creates a positive feedback cycle, and it's not just a matter of refeeding, it's a matter of nourishing the gut. So yes, what you said, that is something I've thought about a lot.
Yeah, that makes a lot of sense. Like you're basically repairing that positive feedback loop to where if your body is able to absorb the nutrients that you're eating, everything
Mm,
is going to be better.
yes, also true.
Everything. And so, I mean, it is a matter of healing leaky gut syndrome, or I mean, or you might call it hyperintestinal permeability. But then also the absorption piece is super, super important for the repair of your organs, including the brain.
Mm,
And you mentioned eating carbs, healthy fats. The brain is mostly made of fat,
mm,
and so fat is not to be demonized. And so
yes.
it's like definitely one of those things that, yeah, we should seek out good quality, but we should also make sure our body is absorbing it and using it correctly too.
Hmm.
And that's where the digestion thing comes in.
Yes. Yes, I agree, and that's approaching it from a holistic perspective. I think would take that into account to not just eat enough, but let's make sure your body's getting what you're eating, and that we're targeting specific things that we know it's lacking because of past history. So, yeah, I would agree with that.
If you want to support this podcast, go to kofi.com/Cody Cox. That's ko-fi.com/Cody Cox. As you watched your mom overcome an autoimmune disease, what were some things that she found to be the most helpful in her recovery?
Mm,
So we're kind of shifting away from the
sure,
eating disorders for now. I think we'll probably transition back to it as we get closer to the end,
sure.
but I'd really like to touch on the autoimmune disease just because we haven't talked about that before on this
Mm,
podcast.
yes. Well, that is yeah, I'll give the maybe the Cliff Notes version, but my mom struggled with Lyme disease for it was undiagnosed for I'd say about 20 years or so. Um, got bounced around different specialists, how it goes, and everybody's looking at the symptoms, and so they punch you over someone else to look at your symptoms. Long story short, ended up finally getting a diagnosis and beginning to approach it from a holistic perspective. She also did do a lot of medications, a lot of very intense medications, and watching her go through that, it felt like some of the medications were worse than the disease. But then she found we used a lot of essential oils. That was something that really, really helped her, and some high quality essential oils. And then we used also supplementation, some high quality multivitamins, omega-3 supplementation, and some antioxidant supplementation. And then she did the diet, all the inflammatory things that you could think of for someone in that kind of state that she was in. So, like, no dairy, no gluten, no sugar, no, what was the other thing? There were certain spices she didn't eat. Kind of approaching like a paleo diet, more or less,
Yeah, or
or
AIP.
AIP. Yeah, kind of more of an AIP. And, but,
Yeah.
so the diet was crucial. I think definitely then, um, attacking the line with the oils and the supplements, we saw dramatic. I mean, in a couple months, she was better than she'd been in years. And today, she's recovered and she's busier than I am, and she's very, very healthy. And so I think that was a huge shift for our family, just realizing that there are other options and that it takes work, but you can take your health into your own hands. Not that the medical community isn't valuable, but just its limitations, saw that as limitations. So I would definitely say it's going to be different for everyone, but the diet was huge, and the other supplements as well.
Mm-hmm. So you're kind of setting me up to ask this question. You said you can take your health into your own hands, which I don't disagree
Mm-hmm.
with. But then what would you say the purpose is in hiring a
Hmm.
practitioner?
That's a very good point. I think the purpose in hiring a practitioner then is, um, sort of the same reason that maybe as well, okay, I don't know if I want to dovetail onto that, but sort of like, you can read a lot and you can absorb a lot of information. I think where a practitioner or a coach or someone like that comes into to that be valuable is someone to walk alongside you, someone to take all the information that you've gathered and say, this is what's going to mean something for you. This is what you need to do. Let's try this. And honestly, sometimes you can know all the right things to do. I mean, even as a practitioner, I know this, like, you can know all the right things. And sometimes you're just sitting in a fog, like, I'm not sure what to do next. Having a practitioner come alongside and be your ally and say, okay, like, let's help you reach your goals. And let's talk about specific action steps for what food you're going to include or what supplements you're going to take. And she definitely did get a lot of help from other people. So I think you can do a lot by just researching it yourself, but having allies is always helpful and can help you get there faster where you want to go.
Yeah, and so like I said, I don't necessarily disagree. I would hire a practitioner
Mm,
myself, actually, and the reason for that is because when you hire a practitioner, you are paying for their training and expertise and their
mm-hmm,
experience, things that you don't necessarily have. And sure, you could get experience by doing tons of research yourself. You're probably going to spend a lot of money that you don't need to spend, and you're going to spend many, many hours, months, years doing research that you don't necessarily need to do by simply asking somebody who
mm,
knows.
yeah, yep, yep. And especially if you're dealing with a serious, with illness or you're not feeling well, it means a lot to have someone to tell you, to guide you in the right direction, because it is overwhelming. And I think that that's becoming even more the case, back to what we talked about at the beginning, with so much research now coming out and more voices joining the holistic wellness space, which is great, but it can be hard to cut through the noise. So to have a practitioner who is weeding through all that and is in that, to be able to say, okay, let's go this direction, is very valuable too.
My mind goes toward intuitive eating.
Mm.
So now, like I said, we would shift back toward the
I'll
disordered
come
eating.
around.
My mind is going toward intuitive eating because I recently worked at a university as a therapist. And in a university setting, there's a lot of talk about intuitive eating because they're trying to battle eating disorders among the students. And coincidentally, this university has a pretty big nutrition and dietetics program. And so they're all about the
Mhm.
conventional dietetics principles. And one of those is the intuitive eating thing. And I can't help but kind of laugh at that because their whole message to students was you can eat anything you want. Food is just food.
Mhm. Yep.
And the reason I find that a little bit funny is because it's like, well, if food is just food and I can eat whatever I want, then what's the point in hiring a dietitian?
Right.
Like I said, it's more about you're paying somebody for their expertise, and hopefully the dietitian you're hiring, if that's the route you choose to go, does have the expertise that you need. But just because of the letters after a name that somebody has does not automatically guarantee that they're going to be the right fit for you. And so
Mhm.
you do really have to do the research. And so I really like nutritional therapy practitioners. I'm kind of biased because I am one, but that was after a lot of research myself as I was looking
Mhm.
for nutrition programs. I wanted something with the right
Yes.
perspective.
I wanted to become the practitioner that I'd go see.
Yeah. Yeah. And so that's exactly what I did too. I wanted to become the practitioner that I wanted to see as a client because I wanted a wholesome perspective. And that's what I found with becoming an NTP is that wholesome perspective that I yearned for. I simply wasn't finding it in a university setting, even though I considered it. What made you find the Nutritional Therapy Association?
Mm.
And like for me, it took some digging, honestly, but what led you to it?
Well, I was blessed to have a friend who was an NTP, and so I didn't have to do a ton of digging. She sent me the information. She said you need to check this out because we shared that passion. And once I began digging into it, I was like, yes, resonates. Yes, resonates. This is what I've been looking for. And I know, like you've mentioned in previous podcasts, I mean, it is so completely worth it. Um, just the rigorousness and the thoroughness and the commitment to excellence and the balanced perspective, the fact that you can in the wellness space you can get a lot of really opinionated people about really different diets and different things, and the fact that they brought it all together and we were all united in that common goal, that's incredible. So I definitely love the NTA. So I was blessed to have someone pass it on to me, but I pass it on to everyone else I know.
One of my favorite podcasts, they interview a lot of NTPs. I didn't realize until I was in school at the Nutritional Therapy Association that they were interviewing all these NTPs. And I was like, oh, I guess I'm in the right place.
Yep.
And it's so funny how like as they introduce the guests, they introduce them as nutritional therapy practitioners, but they don't really emphasize the training or
Mm-hmm.
anything. And so I had to find that in hindsight, like just listening to the podcast. And eventually I was like, oh, wait a minute, this person's in
Mm-hmm.
NTP. And so is this person and this person. And I was like, okay, I found the right training.
Yep, yep, you did. Yep, and that's important. I do like to emphasize too just how rigorous the training was because again, you get NTP is not really a well recognized credential. I hope that that's going to change. It's not like when you say you're a registered dietitian, people think, "Oh yeah, wow, okay," but people say NTP and you're like, "What is that?" So really trying to explain to people what it is important because it's not very well recognized. So yeah.
Yeah, I agree. It's not very well recognized. In fact, like I said, before I went through the training myself, I didn't know what an NTP was. I kept hearing it on that podcast, but it didn't really ring a bell for
Mm-hmm.
me until I actually was in the training and I knew what an NTP was. And I've seen similar things like with pretty much any profession that has acronyms that just aren't very well known. So like I'm a licensed psychotherapist, but if you look at the letters after my name, nobody knows what they mean.
Right.
All they care is that I'm a therapist and I can do therapy.
Yep.
And so maybe what we need to do is just stop using the acronyms and call ourselves nutritional therapy
Right.
practitioners so people have a better idea of exactly what it is that we
Yep.
do.
Yeah, I would agree.
So if you were to work with a client with disordered eating, what would be the main approach that you take to help them not kind of slip into that unhealthy mindset toward food?
Right. I think most importantly is making sure that the situation's not beyond scope because as much as I wish that there was more holistic perspectives and a more of a holistic healing mindset in eating disorder recovery, it's of course very important to realize that if someone's in a really serious situation, they need to go get medical attention. And there are some very serious situations. I think ideally, if I were to work with a client, it would be somebody like myself who has a past of disordered eating and is trying to find a deeper level of healing, um, beyond just maybe the calories in, calories out that a registered dietitian might take, and trying to. So once we establish that they're in a stable place, in terms of not going into crisis, I think I would do an analysis like any other patient, but or client. But to go back to your point, digestion first. What's going on with the digestion? How can we begin to heal that? Because that's going to alleviate a lot of mental stress, and it's going to make you feel better. And anything else we do after that, I mean, that's one of the core foundations of the Nutritional Therapy Association is the digestion and elimination, um, pillars. So make sure that that's working well. I think then probably secondary to that would be the endocrine system. So I know for me personally, thyroid was a big thing. Adrenals are a big thing because in a passive disordered eating, you're putting your body under so much stress constantly, and your body's constantly feeling like it's in starvation or it's out or it's just in experiencing a lot of stress. So the adrenals get overworked and the thyroid. So intentionally nourishing those and working to get those back online. And I know especially with a lot of women, it's a problem in uh, dieting and disordered eating to like lose your menstrual cycle and to be completely off balance with hormones. So I think after digestion elimination, it would be hormones, and then just working from there with any other symptoms that they might have. But I think those are probably the biggest ones.
Yeah, yeah, I totally agree. And from a therapy perspective, so even before I did the nutrition training, I kind of perceived that the hyper focus on tracking numbers was just creating more of an
Hmm.
issue. And so, like, I got some nutrition training before becoming an NTP, but I would really push clients to just focus on the quality of their food and not really pay attention to the calories, not pay attention to how many grams of fat or how many grams of protein they're eating, because it's that obsession with the
Hmm.
numbers that creates, or maybe it doesn't quite create, but it at least perpetuates that
Yes.
perfectionistic mentality of food, and it creates that anxiety around food where it's like, oh, I didn't quite have the numbers that I wanted to have or that I feel like I should
Hmm.
have. So instead, like I mentioned intuitive eating earlier, which I'm mostly against, but not entirely. And the part that I'm not really against is the part where you're paying attention to your body, in that your body will tell you when you're done eating. Your body will tell you when you're hungry, and you should learn to pay attention to those signals, because that's where you're going to get the most valuable information. It's not from
Hmm.
the numbers.
And yeah, I could do a diatribe on intuitive eating too, but because I think it's a great principle in theory, but I think it fell victim to what a lot of great principles do is that they become very popular and then they become diluted and they become misdefined and they become defined in ways they were never intended to be defined. And I think it was part of that intuitive eating that drove me to this holistic perspective because if you read the original book, which is a really good book, it talks about gentle nutrition. But in the conventional disordered eating world, a lot of it's treated as, at least in my experience, a lot of nobody's really willing to say what that is. And there's kind of this nutrition agnosticism where everyone's like, oh, yeah, nutrition, gentle nutrition. But nobody's willing to come down and say, like, this is nutrition, this is not, because of, not wanting to be so dogmatic. So, I think that being the intuitive eating piece, like you said, really good for your mental ability to eat well and to be mindful. Like you've talked about before, being mindful with your food is always a really great idea, but it kind of starts to break down if you're trying to use it as your entire governing principle for all of your nutrition, I think, because then you won't really go anywhere beyond that. But the mindfulness piece is for sure very important.
Yeah, it makes sense. I mean, you want to approach everything with
Mhm.
wisdom, right? Like you don't just blow it out of proportion and just go crazy with just one tiny perspective. And another way of putting it is to just keep everything in moderation.
Mhm.
So obviously, like if you feel like you feel better eating more carbs, that doesn't mean just eat carbs all the
Right.
time, all day, every day. You still need other
Mhm.
nutrients. And we see that in life too, where it's like you can't just take one approach because you feel better and blow that out of proportion because you need other quote unquote
Mhm.
nutrients of life,
Mhm.
right?
Yeah. Yeah, I agree. And balance is something that disordered eating really doesn't have. And so as you begin to recover, there's more of that balance and freedom and just the ability to be okay with a lot of different situations, a lot of different ideas, and being comfortable with food that comes in a lot of different packages and viewing it from that perspective. So, yeah.
Yeah, so that's kind of been my approach is I really encourage people to stop paying attention so much to the numbers. There is some value in it. So again, we're not blowing
Mhm.
out of proportion. It's more like pay attention to how many ounces of water you're drinking, especially if you tend to not drink
Mhm.
enough, but don't obsess over it.
Yes.
For example, I carry around a 40-ounce water bottle and I know that I need 80 ounces a day. So it makes it really easy for me to do the math. I just know in the back of my mind I need 2 water bottles per
Mhm.
day and I'm pretty good.
Yes.
There are ways that you can track the numbers and simplify it to where you're not having to keep doing math
Mhm.
all the time and make it a hyper focused part of your
Yes.
life. What tips and tricks have you found to be helpful for those things that might need to be
Mm.
tracked, but maybe there's a better way to do it to where we're not hyper focusing?
Something that my some of the nutritionists and dietitians I was working with in my recovery process, it was really helpful for me is doing things in ranges or doing things in generalities. So instead of saying, you need maybe you need to have this many calories or you need to have this many carbohydrates, say at the meal you need to have 1 to 2 servings of carbs, or in a day you need to have 3 servings of fat, and then kind of roughly define what a serving is. But it kind of takes the numbers, the hard and fast 31 grams of this out of it, and gives you a little bit more freedom to think of food as a nutrient in general. So, also known as tracking macros. And again, people can be obsessive with that too, but thinking of things as ranges as well to give freedom. Um, so someone's not like, oh, I can't have another serving of carbs because I'm only supposed to have 1 carb at this meal. It's like, okay, well, 2 to 3 servings of carbohydrates, and kind of letting your brain think in terms of, oh, there's flexibility here. So I need to be intuitive to think some meals I might eat 2, some meals I might eat 3, and um, so that speaking in generalities and also changing maybe the metric you're using to measure is helpful.
Yeah, I love that. And something we need to remember is the
Mm.
body is dynamic. So I mentioned how I shoot for 80 ounces a day, but sometimes I don't need quite that much, or
Mhm.
sometimes I need more. And so I love that idea of just thinking in terms of ranges, where it's not black and white. It's just according to what your body needs from day to day and how you feel too. I mean, I could force myself to drink 80 ounces a day, even on a really cold day when I'm totally sedentary. But quite frankly, if that's the case, if it's a cold day and I'm sedentary,
Mhm.
I'm not sweating, I'm not putting forth any physical exertion, I probably don't need 80 ounces
Right.
of water. Let's be honest. So I can give myself some grace and say, maybe I only need 60 ounces, and that's
Mhm.
good enough.
Yes.
And so that's kind of the paradigm shift that we're looking for when we're moving away from the disordered eating and more toward a wholesome healthy eating. Is it's more about recognizing when things are
Mhm.
good enough rather than black and white, good and
Yes.
bad.
Yes, I agree. I think that's a hallmark of disordered eating and eating disorders is just not recognizing the body's flexibility and going off of hard and fast rules, trying to fit your body into a mold instead of understanding what rhythms your body has naturally. So yeah, I agree with that. That's a huge step. And it can be hard to do, but once you take the step, it's very freeing.
we're coming up on the end of our time. I'm going to just ask you one question that I like to ask people at the end, and that is, if you could change one thing about the way people approach health and wellness, what would it be?
Yeah, I think I'm going to go kind of philosophical on you with this, because I think this is going to be very broad spectrum, but I think something I see is just, I wish that it was more popular to think about your health and wellness as a patient journey. I think because of so many years following a medical model, it's a very, I have this problem, do this one thing, like a medication or a therapy or something like that, and fix it. And just running into that with different clients to realize that this is a journey, especially depending on where you're coming from. And sometimes it takes a little experimentation, especially if you're getting into the real food or the whole food thing for the first time. It takes some experimentation, and it takes a little bit of time. And it just takes patience, but it's worth it. And the advantage of taking a more patient approach is you're going to have more long-term results. And getting people to value the long-term results over an immediate fix is something that I think is a huge seismic shift. But once you get there, then it just changes everything, and you realize that you can live healthier longer. It might take a little more work, but it's worth it. So I think that's what I would say.
I love it. It's very much an NTP perspective, where it's like you're looking at the long-term results, and yeah, you'll have small wins as you go.
Oh, for sure.
But that's not really what our goal is, though, is to have the immediate wins, right? And we are kind of used to that in conventional medicine, where it's like, oh, doctor, I have this ailment. They run some tests and give you a prescription and send you on your way for the rest of your life. But you keep taking that medication for the rest of your life. The alternative is to have more of a holistic perspective, where it's like, I'm going to feel just slightly better. Maybe it's 1% better every day or every week, but it's still better, and it's going to be so much more sustainable and so much more profound after years of having this healthy lifestyle.
Yes.
So love it. One last thing, how can people find you if they are looking for you?
Yes. If you want to, you can always email me. It's enduringwellness@outlook.com. And that would be the best place to find me, to send an email there. I am currently developing like a website, but that is not quite ready yet. But it is enduringwellness@outlook.com would be the best place to contact me, for sure.
Okay, awesome. Thanks, Abigail.
Thanks for talking. It was good. It's a good chat.
Real Food Mental Health is intended for informational and entertainment purposes only. The information presented on this podcast is not intended to replace any medical advice, diagnosis, or treatment. While I am a healthcare provider, I am not your provider. Always seek the advice of an appropriate healthcare practitioner with any personal questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on information provided by this podcast is at your own risk.